Well, good morning. It's 9:30, so I'd like to get us started for our day. We have quite the event planned today. Welcome to Chances Are, the Opioid Awareness Event. We are super thrilled that you're here. Welcome to St. Luke's United Methodist Church in Essexville. Just like to let you know that if you are in need of a church family or would like to explore some worship opportunities, we worship every Sunday morning at 9:30 right here in the sanctuary, as well as through Facebook Live. Go to St. Luke's UMC Facebook and we'll be on the camera there. Pastor Jenaba Wagey over here, she presides over our church. Language. We're going to learn about that later. She presides over our congregation and our church, and we're thrilled that she is with us today. And she has prepared a prayer for us to think about as we move through our day today. So, Pastor?
I appreciate the idea of residing over the church like I live in the attic. It's nice up there, warm in the summer. Would you join me in prayer? Holy One, thank you for this opportunity to come together and learn, for we are a people who are constantly changing, creating, and educating ourselves about how much is going on in this world of yours. Open our hearts and our minds, Lord, to these places in which ministry happens, in which health happens, in which hope happens. Give us the space to hear what needs to be heard and to celebrate all the ways that you are moving in, through, and around us as we bring healing to your world. One person, one moment, one piece of love at a time. Thank you, Lord, for the ways in which you invite us ever to be building your kingdom here and in the yet to come. We pray in your name. Amen.
We do have a few announcements before we get started. I'd like to make sure that you have signed in with Nellie. Nellie was located out by the Welcome Center, and that's where you should have picked up a packet and a folder. If you do not have one of those, if you want to raise your hand, we'll get one to you. And then just make sure that you've all signed in. We'll use that for contact tracing. Our church requires that everyone wear a mask while inside the building except when presenting, so thank you for all wearing your masks. We are recording today, so please make sure you smile behind the mask so that folks can see that in your eyes. The bathrooms, that probably should have been the number one thing, correct? The bathrooms are located, just go completely outside of the sanctuary, make the left as you're going back toward the welcome desk. There's a hallway there, so the bathrooms are kind of right straight across this section here. The men's and women would be on your left-hand side as you go down the hallway from the welcome desk. We have with us today a showcase of support services from our community. Our speaker today, Barry Schmidt, he will talk about those support services, and we will all have the opportunity to go to the fellowship hall, which is beyond that hallway where the bathroom is, and visit with the support services. So please take the time and talk with those folks so that you can learn more about what you can do to help and what services are available in our community. I would like to now introduce our main speaker for today. Barry Schmidt. He is a substance abuse prevention consultant a project director with the Neighborhood Resource Center, and the project coordinator for Bay County Prevention Network. Over the past 30 years, Barry has worked with communities, youth, and parents on health and quality of life issues. He is responsible for assessing, planning, and implementing a wide array of programs in the arena of substance abuse prevention. In 2019, he became the chair of Michigan Coalition to Reduce Underage Drinking and East Region Recovery-Oriented Systems of Care. He is a VP of Families Against Narcotics, Great Lakes Bay Region. He has created an anti-stigma campaign that is present in 12 counties throughout the state. Barry is a graduate of Bay City Central High School. He possesses a bachelor's degree in health sciences and community development. He has a master's degree in public health from Walden University, a master's degree in health promotion management from Nebraska Methodist College, and has been a prevention consultant for over 20 years. Barry won the 2017 Hometown Hero Award from Michigan Public Health, and in 2017 and 2019, he was the Partner of the Year for the Great Start Collaborative. He spends his time with his wife, enjoys traveling, and is actively involved in church, and I am honored to call Barry my personal friend. Barry Schmidt, please help me welcome Barry.
Thank you, Brenda, and I have to live up to all that. Yes, first of all, I'd like to thank everybody for coming today. It is 9 in the morning, and I appreciate that. It's a Saturday morning especially. Secondly, I would like to thank St. Luke's for putting all this together. It is partners like St. Luke that actually make this worthwhile for a job. Every single day I get up, I go and do this. I had a young man one day ask me, "Why do you do that? You don't make that much money." I said, "Well, I make a difference, and that's worth that any money can actually pay me." Additionally, I would like to thank our resource tables, which you'll see today, which we have Neighbors Against Drug Abuse, we have Families Against Narcotics, Great Lakes Bay Region, we have List Ecological, as well as 1016 Recovery Network. They were personally invited because they are a strong partner of the Bay County Prevention Network. So to give you an idea what the presentation is going to look like today, first and foremost, we will have some basic information understanding how we got here. How did this all happen? And you're going to get a lot more information than you ever wanted. So you're going to be highly educated. That's what I always tell people too. I'm highly educated, but it doesn't mean I'm smart. I have lots of degrees. They also have an opportunity during break that we will show some of the stigmatic video. If you've never seen it, it is basically about Bay County. So we'll have that during break so you can get the resources, and when you come back in here, you can see that a little bit as well. We'll have some videos throughout. We will then move on to talking about Narcan. We'll do a very basic Narcan training to understand what it is, why it's here, and why it's important. Additionally, with that, you will have an opportunity to receive a Narcan kit free of charge from your tax dollars. Okay? So you might as well get your tax dollars out of it, right? And then we will move into another break, and then we'll have a Words Matter. So you're talking about language. Language is so important. I have a little pre-survey for you. Don't worry, you're not being graded. To take a look and see where you're at with some of the issues. And then we will have my esteemed colleague, Lori Zielikowski, talk about her story and how this has a human element to it. I'm going to show you numbers. I'm going to show you different things. But the human element really is the most important thing. And that's why we're here. And she talked about a lot of things I've been involved in. One of the things I don't always mention to everybody is in 1984, I told some people, for my church, I was almost sitting right there. I was almost there. So God works mysterious ways. All right, Andrew. There we go. All right, so this is my life verse. I look at this every single day I can, because if I don't have the trust in the Lord with all my heart and I try to lean on my own understandings, this is not going to work. But if I know He's in control and that He is the one that's going to make a decision about what's going to happen for my steps, that's the only way I'm going to make an impact. And every single day I look at this and think about this. So it gives you an idea of the why. Kind of broke that down. All right. Here's our coalition mission. Basically, we are a community-based organization. We've been around for over 30 years. In fact, November 1st, we're having our 32nd celebration. And we are going to be honoring one of our founders of what is called the Jill Warden Founders Award. Jill Warden was a staunch preventionist that was in our community that actually started the Bay County Prevention Network. And sadly, we did lose her to cancer a few months ago. So we'll be honoring and celebrating her life. But it gives you an idea. We're looking at all the things. We're not just about saying don't do it. Have you heard that? Just saying no, just saying no. Great slogan, but you'll see why it isn't really the solution. So let's talk a little bit about the problem. This is an older one, but it gives you an idea historically. You take a look at all the deaths that are preventable, and you can see you have methadone, you have synthetic, you have heroin. Everybody's concerned about the heroin issue. Would you agree with that? But look at which one was the one that really was the issue. It was opioids. We can thank Purdue Pharma now. We know we can say that because there's a settlement going on right now in a lawsuit. So that gives you an idea where we came from. And this started in 2000. What is interesting is that we had what was called the Prescription Drug Subcommittee in 2000 that was working on this. And the law enforcement officer in the group said, pills are now passe. They're all turning to heroin. And that's when we started seeing that's when we started having deaths. What was it, 28 deaths in 28 days, I believe it was, in 2018. So we've been working on this for a long time. The opiate epidemic is something that I think has been overshadowed, in my opinion, from the COVID. I'm not trying to diminish what COVID did and how it affected individuals, but 70% of the 71,000 overdose deaths were opioid related. 71,000, okay? If you multiply that every year, we've passed COVID, okay? If you look at that from a standpoint even more across communities, it has devastated communities more than anything else. Ask West Virginia. West Virginia, as an example, had a company come in and they made sure that every individual in that community had anywhere from 1,000 to 5,000 pills available to them. We know that with accessibility increases risk. And I'll talk about how that actually can impact other areas besides opioids as well as we move forward. So this is from, you can see it just came out, 2021, looking at the number of drug overdose deaths. You will notice that from January of 2015 to January 21, we didn't go up. I'm sorry, we didn't go down. We went up. So everybody thought, well, the opiate epidemics, no, it was there. It's actually been worse. And we'll talk about why that is. And I encourage you to talk to recovery coaches. I know we have 2 recovery coaches here. We have Alicia here, and we also have Jasmine here as well, and others. Talk to them. They'll tell you why that is, and I'll talk a little bit more about that in a little bit. And then I want to give you any historical data as far as 2000 to 2016 in Bay County. If you can look, okay? So you can see the accrued death rate there, right? Good. I'll tell you some good news in a little bit. And then I look at the Michigan Overdose Data to Action. This is brand new. Brand new. Which means this was never there until we just got it. It just came out like a week ago. So getting data before was like pulling teeth. You'd have to have good relationships with law enforcement, which we do. You'd have to have good relationships with the medical community, such as the hospital, which, by the way, I'm also an employee of McLaren Bay Region as part of their grant-funded programs. So as you can see, prescription drugs was something we need to be concerned about. What you don't see up there is in 2015, Bay County had more prescription drugs prescribed than Detroit. What you don't see there is in 2015, the federal government offered the states money for a programming that could actually impact some of those things, including advocating for policy change. Bay County was a recipient of that grant, a 5-year grant that just ended in 2020. Because of that, we have increased opportunities. You can see the legislation change, because if you look at 2020 quarter one, 1.25 million, 1.2 million prescription opioids were dispersed in Bay County. I'll say that again, in Bay County. Think how many bottles that is. Okay? Feel free to ask any questions along the way too. And then we look at the number of overdoses regarding EMS. Now, I want to let you know, this doesn't represent all of them because maybe EMS wasn't called. In 2021, according to the Michigan Department of Community Public Health, there were 21 EMS probable opioid overdoses. Well, if you take a look at naloxone, which Narcan, by the way, is what naloxone is, you can see, you look at the numbers for March and April of 2020, wasn't there, but what do you see in 2021? See a big spike, right? Well, guess what? When you give Narcan, which we'll talk about, save a life with the spray, you end up lowering those people that have come to EMS because the community members already have it available to them. So a lot of times, yes. Those are just the ones that it's just the ones that were EMS reported. It doesn't necessarily mean they died. So, and the good news is that we're not losing as many people. However, that doesn't always, I always say that death is final, but there's other things along the way that make it worse than death. So we'll talk about that in a minute. But if you look at this, and you can see, if you don't see it, in the state of Michigan, 804 treatment and recovery centers had Narcan available. 396 this is Bay, I'm sorry, for Bay. 396 kits were given to community organizations, nonprofits. The two biggest organizations that I know got those were Families Against Narcotics and the Bay County Prevention Network, they're community-based organizations. I know I ordered probably 200 myself. So, and then you look at what's called PHIP, prepaid inpatient health plan. That's how we get funded. They only had 12. Well, that's because they're the ones that recommend and tell us where to get them. There's actually a portal now that you can go to as an organization. Your church could too, by the way, and actually order these kits for free because it's your tax dollars, by the way, once again. Okay? So then we take a look at the overdoses. Remember I told you earlier the deaths are part of it, and it is. Looking at the data from the Michigan, the Bay City Public Safety, they gave me their data, and looking at the sheriff's data from January to September 18th. Now there may be some overlap, but not a lot, by the way. 107 overdoses. 107. Bay County only has about 50,000 people if we're lucky now, 40,000, something like that. 15 of those were deaths. And look at how many Narcan saves there were. You see there's more Narcan saves than overdoses, right? Because sometimes you have to give them more than once. Sometimes I have to give them 3 times, 4 times, depending on what the actual opioid is that they're using, whether it's an illegal or illegal or what's laced and things like that. And I'll show you something in a second here. And what I can tell you right now is since COVID, 33% of probable overdoses has increased in the EMS according to the national data. Emergency room visits have increased 42%. Okay? I was with a young lady yesterday, and we were doing a Prime for Life program, and she had injured herself, and she went in the emergency room. She went to Bay City, Saginaw, and Midland, and they had anywhere from a 3 to 4 to 8 hour wait. If an individual is struggling with substance use, they're not going to wait 3 to 4 hours to get into that. Okay? Then if you take a look at this data, here's a little harder to read. This is from 120% more deaths nationwide, around 2,036 deaths in Michigan, and that would be in 2018. 5 deaths a day is what we've been averaging in the state of Michigan, and a 20% mortality rate, especially by the African American community. So it gives you an idea of all those things. And as you can see in the bottom, if you can't, it says a 15% rise in 2020. Anybody have any questions so far? Okay. Maybe, come on, work. There we go. I wanted to show you this because I talked about prescription drugs a minute ago. So you see that bottom one that's in green? That's morphine, okay? Morphine's a pretty powerful drug, right? Would you agree with that? The one above it is heroin. Heroin is 2 times stronger than morphine, okay? Which means it's 2 times more addictive. But now, if you also look at, you add fentanyl to it, that's 100 times stronger than morphine, okay? If that wasn't bad enough, yes, ma'am. Well, it just 1 times itself. That's why it's saying more. Yeah, thank you for asking. I appreciate that. 100 times stronger than fentanyl, than morphine. And then we got carfentanil. Carfentanil is designed to put an elephant down. Say that again. Is designed to put an elephant down. That means when we had this 28 deaths in 28 days, according to Lee Howie, when he was the emergency EMS director at McLaren Bay Region, they would, for the ambulance crew, he would say that most of those were carfentanil. Now, I'm not aware of how much carfentanil we're still seeing, but I'm sure we're seeing some of it. Fentanyl, I know, is still out there because I'm hearing about that still from individuals. And the thing I want you to realize when we're talking about all this is that change is a process and not an event. So I'm going to have you do something. I love the interaction part. Take your hands and go like this. Whatever thumb is on top, switch it to the other one. Does that feel weird for anybody? Now you got an idea how it is to change addiction. Do you see how hard that was? I have a slide in another presentation that says change is not rocket science. It's harder than rocket science. A community changing is part of that as well. A community has to be ready to change. A community has to have the knowledge, the information, and the willingness to actually make that change. So I always like to do that because it is a process. It's not an event. People think, well, they can just stop using anytime. Anybody heard that said before? Guess what? Sometimes it's 19, 20, 25, 30 times before they end up actually changing. And unfortunately, our systems are not set up like that. Do we tell a person that has diabetes, as an example, that, yeah, we're only going to give you so many insulin, that no more of that? Because if you look at, there's a Facebook, it's not the official one, called Bay County Scanner. It's not official. Make it very clear. It's not an official Bay County thing. There are people on there that say, we'll only give them 3 things of Narcan. After that, we're going to let, Darwin take care of it, the survival of the fittest. So you have a lot of individuals that are doing this thing because they don't understand that change is a process. Without understanding that and knowing that, you can do more harm than good. Because there are individuals who say, well, you can just stop using. It's not that easy. And I have talked to enough people in recovery to know that there's a lot of things that have to happen for all of that to happen. And we'll talk about some of those things. And remember, you do have resource tables that have support and information to help you with that today. So why does this all happen? That's always the question. Anybody ever seen this before? Even my professionals haven't seen this. This is called the public health model. We have an agent, which is going to be the drug. We have the host, which is the individual, and we have the environment, which is going to be where we're at, okay? Where you live, those kind of things. If you can affect the environment, you have more success than you do trying to affect the agent, okay? I'll show you as we move forward in that process. This is called a social ecological framework. I know it's all technical terms, right? Basically, it's saying is that we're not in a bubble, okay? There are things that, so let's say as an example, we have a young person up here that is struggling with, I use underage drinking as the easiest one to do. Underage drinking. Well, that individual is also affected by their friends and family, what role models they are, society, what society says is acceptable, not acceptable, and then organizations, what organizations are there to help, what organizations are encouraging them to be involved in health enhancing behaviors. A community, what is our community? So I'll use underage drinking. Think about this one as an example. It's all interrelated, by the way. Name one festival in Bay County that does not involve alcohol. Okay? I bring that up because they're interrelated. And then you got public policy. Okay? Underage drinking before, when you got caught when you're an underage drinking person, I know this is all opiates, but you'll see the connection in a minute here, that they would end up going to a class, getting educated, and it was working. But some lawmakers thought that, well, we don't want to make them wait. So they decided instead of making it something where they had to do something, we're just going to give you like a speeding ticket. So our underage drinking numbers that we had, 200-300 before went down to under 20. And really quick, because of that, and you'll see how this is all related, Bay County has the highest rate of 30-day alcohol use for high school students in 2019. That was prior to COVID. So you're saying, what does it all have to do with opiates? Well, think about it. If you have an individual that is using and they don't have the knowledge and skills to understand what is doing, and you have friends and family that tell them, tough it out, you can do it, just stop. And then you have organizations that are not supporting them. They're trying to work or whatever, and their job says, we're just letting you go and not trying to work with you. Then you get a community that says, you're an addict. Why would I want to do anything for you? You're a drag on society. Which in turn then, public policy says, we need to lock these people up. You see how that kind of interrelates? That's a social ecological framework. That's kind of all it works. So any individual is affected by all those things, and it comes back the same way. Any questions on that? Hopefully it's making sense. Then we have these things called risk and protective factors. There are things that put people at risk if they had what are called adverse childhood experiences. Example, they have a family member that has substance use problems. They have a family member that's incarcerated. They have been abused in some way, physically, emotionally, or sexually, as well as their home environment. If they've been yelled at and not, you ever see the parents in the store that yelled at their kid and just don't want to have any respect for them? Okay, that's an adverse childhood experience. That's an example. However, there are risk factors. Guess what a big protective factor is that can help buffer against those risk factors? You're sitting in one right now. Churches. Research shows that individuals that are involved in churches and have a connection to that are less likely to use substances. Why is that? Because the value system. If you have a value system that says that this is something that you want to work towards instead of going against. So think about that. When you're driving your car, do you want to look forward more or in your rearview mirror? You want to look forward, right? So if you're looking forward to what you can do and how you can be a better member and how you can be a better body of Christ and things like that, that in turn makes it easier for you to make the right choices. So that's an example of that. Not to mention being involved in sports can be good things, having good families, parenting skills. I always laugh about this one because when we have a parenting class, guess which parents show up? The ones that probably really don't need to be there because they're really good parents. And I would say, I've had about 15 parenting classes myself. Am I a perfect parent? I've never been a perfect parent. But you can always learn something. But the ones that really need it, they always think, well, I don't need that. And then they're calling us or they're calling Lori down the road because their son or daughter might be doing some things. And that isn't always the case, but sometimes it is the case. So there's also attachment. If they're attached to people, they have opportunities to be involved in the community. They have a purpose. Those are all protective factors. So I'm giving you Prevention 101. All right. Look at that, 10 o'clock already. Perfect. So let's take a quick break. Half hour. I don't like to do more than a half hour, 45 minutes. So you can get. We have the fellowship. Sorry. We have all the resource tables. So resource tables. If you want to go ahead and head to your locale. And thank you everybody for coming back as promptly as you can. I'm trying not to do more than 30, 40 minutes because I know sitting in a seat so long gets to be boring after a while. And then I think the resource tables are a very necessary thing. So I encourage you, if you didn't go this time, to go next time at the break. The video stigmatic that I was showing, we'll give you the link. And actually, he has it on the computer already. So you guys can show it at any time. My colleague, Rebecca Morgan's son, Garrett Morgan, and some others that I had heard about were involved in that. So that was kind of cool to hear about that end of it. So, and I have a little cameo in it too. So, one of the things people say is, how do you know if somebody has an opiate issue and a heroin issue? Well, I'm going to show you a video that's not my video because I'm not this talented, but it's out of Cuyahoga County, and I actually believe it's probably one of the best videos that I've seen to actually show you the signs and symptoms and things like that. All right. Hopefully we get everything good. Now, it's not one sign. There's multiple signs to look for. I always tell an individual, if the person's not acting like they normally would act, maybe it's time to get some sort of assessment. Maybe it's a mental health assessment. Maybe it's a substance use assessment. Maybe they just need to talk to somebody. Maybe just need to talk to a recovery coach, because not all those things are always going to be prevalent, but it gives you an idea of what can be, and a lot of times is, some of the signs. I think it's one of the best videos that I actually have found that they made from, let's face it, from Cuyahoga County there. And what I can tell you as well with that, when you're looking at the signs and symptoms, is individuals that have those signs and symptoms aren't bad people. Okay? They may be struggling with something. They may be struggling with the loss, may be isolated. And that's one of the things that COVID had really done to the recovery community. It's really isolated them. They did have availability early on. Some of the organizations had Zoom meetings. Okay. I don't know about you. I am zoomed out. Okay. So they missed that connection with people. Humans are designed to have interactions with people. That's why it's so great to have this in person today. Online, we could have done it that way. I've done it for other places, but in person is so much better because you can actually have an opportunity to see a person, have human connection. So what is an opiate overdose? That's what we're going to be talking about. And as we continue talking about that, we're going to talk about the life-saving tool and some things to look for when you're looking at all those issues. So if you have any questions along the way, feel free to ask. And if any of my other experts in the field want to chime in anything, please feel free to, because I am no expert. People call me an expert. I said, no, do not put that title on me. Basically, the opiate receptors are like a key. So it kind of opens it up, and it allows for the opiates to be there, and it gives so much more, a rush of all those things, and too much of that opiate, then with that key open, there's nothing to shut it off. So if that key opens it and is still going, it fits exactly on the receptor, which in turn, that's why people think about, why do you take an opiate? You want to take away your pain, right? That's why. That's basically what it's designed to do. And it is true. It will take away pain. However, it has other side effects as well. It may be emotional pain. And think about this for a minute. Pain is considered a lot of times in our society as a bad thing. You hear that? I need to get rid of my pain. I'm going to say something really controversial, but I love to say it anyway. Pain is natural and normal. If you don't have pain, that's a bad thing. Okay? When I turned my ankle, when my wife turned her ankle just recently, she has pain. She wanted to do everything she normally could do. I says, you cannot do that. But I want to do that. I said, you're in pain. Yes, but no, you're going to mess your ankle up even more. Pain is telling you there's something wrong. When my mom passed away, unexpectedly, I had emotional pain. I had to deal with it. I had to work through it. For me, I use my faith. Other individuals will use substances. Sometimes for physical pain, as you saw the young man in the video, he had an individual that injured themselves and that. I mean, back in the 2015, you could go get a surgery done or have an injury, and you could get 90 pills of Vicodin, Oxycontin, or one of those other opiate medications. In fact, until probably a year ago, at least that I'm aware of, you could go to a dentist and get a wisdom tooth out and get 90 days worth of medicine. You don't need 90 days. And in the hospitals they were guilty of this as well. The doctors were. And now they're kind of cutting back, and they only allow a very low amount because they did some studies and they found that after 3 or 4, they just basically hold on to the rest of them. And if you don't know, in your packet when you first walked in today in your little thing is a black bag. That black bag is designed, thank you. That bag is actually designed to put unused expired medication in it. All you have to do is open it up, put water in it, open your pill bottle, because I tell people to put it in there, they'll put their pill bottle in there. No, that's not going to work. You open it up, you pour your pills in it, and it'll dissolve it. And you can throw this right in the trash, and it's environmentally and biodegradably friendly. Okay? Those are free. If you need more, if you wanted like 75 for your church, just let me know and I'll bring them to you. Okay? We want to get them out of the medicine, out of the cabinets. But what I will tell you is that's one of the things that we didn't do a very good job at in 2015 when it all started as preventionists, and we're going to take responsibility for this. We got these out of the homes, but guess what it did to the price of heroin? Brought it way down to $5, $6 a bag. The medicines that you put in here were near $40, $50 a pill. So what would they do? They'd sell the medicine. In turn, they could use the heroin. Okay? That's what the opiate addiction is all about. Okay? In this opiate overdose, as I just said, they get that rush of that opioid. They like what it does for them. And in turn, so let's just use an example. Let's say you have surgery of some sort and you take a narcotic, even a few years ago, and it makes you feel good. Well, if one makes you feel good, two makes it feel even better, right? And then three, and then it's don't take them every 4 hours, take them every 2 hours. Okay, you see how that can happen? That's because the brain is susceptible to it. They have shown that you can become addicted to an opioid in 7 days. In 7 days, okay? And sometimes even quicker if you have a family history of any kind of substance use. The more somebody has regarding substance use, somebody says, well, I don't have that in my family. Okay, do what's called a genogram. Mom's side, dad's side, color in both sides, and look at how many people end up having drug and alcohol problems. My family, alcoholism runs very rampant. I'm a Schmidt, tell you any more than that. German, okay, it's right there. I'm on that side. I'm also Van Warmer. It's also on that side. So, I mean, family history really makes a big deal when we're looking at, and just so you know, everybody is born with an initial tolerance level. So some people could tolerate the medication as far as taking it, take 1 or 2, okay, I need more to make me feel like it, okay? Because that initial tolerance level is higher, they may think they need to do more. Reality, they probably don't. Does that make sense about overdosing? Okay, I try to make it as simple as possible because I'm not a doctor and I don't play one on TV. So I gave you a little bit of idea why it happens. Okay, number one, as I said, it may be somebody trying to deal with an injury. And there's many individuals that have had injuries that ended up doing that. It may also be that they're trying to escape reality. So, you think about reality, it's not fun. It's not something you want to be there for all the time. So escaping, and I mean, college students and high school students and even adults, we all deal with a lot of stress. Stress is hard. And because stress is hard, we a lot of times find shortcuts. Well, if you don't believe in shortcuts, how many people, when they're hungry, if they're around the area, you just pull up to McDonald's or Burger King and get yourself a burger? Now at $37, but exactly. So anytime we can change things so quickly and take care of a need, we believe that is. I mean, fast food is not the healthiest for me, by the way, especially my history of heart disease in my family. The same thing goes with this. So if an individual is now dealing with pain, whether as I said, it's emotional, physical, or even because they're just isolated in some way, have some mental health concerns going on, okay? or they just want to have what we call one of 4 personality traits. They're gregarious, social butterfly. They are impulsive. They don't think, they just do. Rebellious, which is somebody basically breaks the rules. Okay? There's one more I got to remember. I'll come up with it in the top of my head. But the point is that those traits actually increase the risk. It doesn't mean that people have those are going to have the problem, but it increases the risk. And that's one of those risk factors we were talking about. Okay, so how do we prevent it? Well, individuals, and this is where it gets into a little bit of the harm reduction. And this is a very cautious tale for individuals, but we need to know about this information so individuals that are using can make sure that they're safe. We don't want people dying, okay? But I'm also cautionary when doing this as well, because I want to make sure that we're understanding that my goal as a preventionist, first and foremost, is to prevent and prevent them from using in the beginning. But I also know I need to prevent that overdose. So I really need to be cognizant of that. Number 1, mixing. That's when they're mixing their substances. We'll talk about these in a minute more in detail. Tolerance, quality, and using alone. So, what sorts of drugs or meds do people commonly mix together that might put them at risk for an overdose? What might they do together? Alcohol and pills. Okay, anything else? Marijuana and alcohol, or marijuana and pills too. Anything else? Yeah, any kind of substance mixed together, getting that synergistic effect where you're not getting a 1 drug effect, you're not getting a 2 drug effect, you're getting a 3 multiple level drug effect. Exactly. That's what we're talking about. So individuals that are doing that increase their risk for overdosing. So let's say that they believe that they have heroin that has only heroin in it, but unfortunately it has maybe fentanyl in it, or maybe they're intentionally knowing there's fentanyl in it. That increases the risk for them to have an overdose. Okay? Well, go back to that. The second one we look at is tolerance. So, who remembers what I said about tolerance that I said a few minutes ago? You're born with an initial tolerance. That's exactly it. That's the first thing we have to know. Some individuals in the room are going to have a higher tolerance than others. And by the way, that means that tolerance isn't an ability, it's a liability, according to the Prime for Life program. I steal my stuff from all over the place. Okay? Hey, it's the best stuff. Why not? But that's what tolerance starts with, an initial tolerance. All right, so tolerance, if you don't remember as well, is the ability to the body to handle more and more and more. So somebody might do 1 and they don't get they might do 2 and then they need, so every time an individual decides to do more than they should, it increases the tolerance level. Remember the hands a minute ago we did? That is one of the biggest reasons why it's so hard to stop. Because when you keep increasing your tolerance level and you keep getting what you want out of it, it in turn makes it more and more difficult to end up changing your lifestyle. And some individuals end up going back maybe to where they were. They realize what's going on. Some individuals might need a little more. So they might go to the court system. Their parents might tell them there's something going on. Or maybe even their husband or wife is telling something going on. Or you might have an individual, after they hear those 3 things, they're like, okay, I need to make some changes. But you have an individual that has those 3 things going on, and they have 4, 5, and 6, and 7 going on, and they just don't see it, and they don't want to see it for whatever reason that may be, which in turn increases that risk because the tolerance level goes up. So as the tolerance level goes up, the ability to overdose goes up very quickly. Would those that are in recovery agree with me? Okay. I want to make sure I'm not speaking something. Please.
It's not that we want to use it. We may begin using it experientially or as medication to numb ourselves because of traumas or because of abuse or because of those types of things. And then it grabs a hold of us. And I just want it to be clear that it's not, a choice we're just saying, I just want to continue using. There's a lot of factors that go into why we use. And it's not simple to quit.
Please.
Sometimes that if you need it for pain, it's okay.
Right. Yep. Exactly. Thank you, Sandy. And I want to make sure that we understand that as well. I never want to say that it is an individual that is involved in it, that it's their fault. Now, in the beginning, it's a choice. I can understand that. However, what she just told you, if you in basically in professional terms, is the brain gets hijacked. When the brain is hijacked, remember, that's why I did that prayer thing a minute ago, because I wanted to see how difficult it is when you change your mind. It is so difficult. And some individuals end up being abstinent free of substances for a while, but there may be triggers and things like that that the brain remembers. Because if you don't know this, we have a blood-brain barrier basically that protects us from different things in our lives. And what drugs can do, including alcohol, marijuana, and opiates and other substances, they cross that blood-brain barrier and they do what's called an indelible memory. So think of it as a cow or something that has to be singed to show whose it is. That's what the drug does. It actually imprints on the brain saying, this is what I need to do to function. This is what I need to do to be successful. All those kind of different things. And it hijacks the brain to think that that's what you need to do. So it's not the individual saying, I don't want to make changes. When your brain is so far along in that situation, you end up having that hijacked. Unfortunately, there are some that may see an image, be in an environment, and think that they can go back to using and they'll be okay. And unfortunately, sometimes that's not true. Because remember, that initial tolerance is what you're born with, but once you've been sober for a while as well with no substances, your tolerance drops. So when your tolerance drops, that means if you try to use back to even close to where you were before, even though you have the initial tolerance, that increases your risk for overdosing. In fact, the first 90 days is probably and you tell me if I'm wrong, Alicia, or any other recovery coach, the first 90 days is probably the biggest opportunity to determine whether or not you're going to continue in your sobriety. That first 90 days is when you have the most triggers, the most challenges. You're changing your life. You're rebuilding your life. And that's the thing about this is that when you're looking at the overdoses, the mixing and the tolerance, individuals may do those things not really knowing sometimes what's going on because the brain is hijacked because they want that specific thing to feel that way. And go ahead, please. Yep, exactly. She's talking about nicotine and the same thing, how it resets the brain. I'd even go even simpler, look at sugar. If I got somebody that drinks 4 sugars in their coffee, and I got one person that drinks none in their coffee, and I give the first one 1 spoonful of sugar, probably for life stealing again, and then one with no sugar, give them 1. The one that has no sugar is gonna notice that there's a difference. But the one with 4 sugars here is never going to realize that they have 1 more thing of sugar in it. So that's examples. Yeah, exactly. Okay. So I want to make it very clear. And thank you, Sandy, for reminding me. So keep me on task here. I like that. Understand, yes, I understand it is a choice in the beginning, but it may be a choice for various different reasons. We talked about that. But once you start using opiates specifically, and even other substances, by the way, your brain gets hijacked and your brain has an indelible memory that says, hey, that made me feel good. I want more of this. And the next time you're feeling that, hey, remember what that did for us last time? Let's do it again. Okay? And then if you're at a situation where at a social, that social butterflies, those gregarious people that like to party, they're partying. They're not thinking about always what the substances are. They're just having a great time. Or if they're using it to relax, unwind. All those are different areas that we're looking at when we're looking at those mixing intolerances. Then you, go back. Then you have to look at the quality. Then you never know what's in those. There could be fentanyl in it. There could be carfentanil in it. Heck, there could be baby powder in it. Or other products that we would never think of, because I'm not a chemist in that. But the point I'm making is that the quality is a big thing as well. Or if they're using alone. If they're using alone, there's a larger chance to have an overdose. And what we tell people is if they're using alone, which we don't want anybody using, make that very clear, but if they are in this situation, that they actually call someone and tell them what they're doing so they can say, call me back in 15 minutes. If they don't answer, automatically call 911 to that establishment. Because you don't know. Maybe they're not overdosing, but I don't know about you. I'd rather err on the side of caution when it comes to a life than I would to worry about whether or not. And if they're alone as well, they have to be able to give themselves, maybe they think they're overdosing, they might have to give themselves Narcan or even chest compressions. You know, they might have to somehow push a chair or something to help them. So that's why it's so important if they are using alone, which some people do, that they do let somebody know about it and that the individual is checking up on them. There is no reality. It's not probably going to happen. Okay? So that's where, depending on the user, sometimes, and this information, by the way, comes directly from the experts at the Red Project out of Grand Rapids. They say that somebody is using a loan to have them call somebody. I agree. I don't think somebody using a loan is really going to think to call anybody, but I'm going with the experts on that end of it. So those are the 4 main risks for overdose. So now you know what an overdose is. So it's basically the brain has adapted to the tolerance level. The tolerance level has gone up, and because the tolerance levels goes up, the amount that they can do is going up. The brain gets all these influx of things, and the key won't shut off, and basically it overwhelms the system, and it basically shuts things down. It basically said, the brain says, hey, I'm taking a break, okay? And they end up, and we'll show you some things they're looking for here. So really high versus an overdose. One of the biggest things we're looking at with an overdose is, do they respond to any outside stimuli? One of the things that we always tell people to do, and I think Lori probably teaches this as well because she does this all the time as well, is you rub that sternum. If you rub that sternum and there's a response, it's probably not an overdose. But if you rub that sternum and there's no response, it's probably an overdose. Because when you rub that, you can feel that, and it's the sensation and all the different things within the system that lets it know that there's something, that somebody's doing something. So when you have that overdose, remember opiates are taking away pain. It's basically anesthetizing ourselves is basically what it's doing, so we don't feel those things. So that's why it's like that until we get out of that overdose. So it's that all those things that are rushing in there, taking over and shutting things down. Because remember, when your brain shuts down, everything else shuts down as well. So all those different organs, and the back of the brain is where everything is controlled. It starts going all haywire in that. Okay, so they might have some slurred speech prior to it. They might appear out of it compared to the really high side. They might have some nods here, scratch a lot, things like that. But the overdose side, as I said, is all about not responding to outside. That's the biggest one. If you can rub their sternum and they're not responding, there's probably an overdose. And it may be an overdose for opioids, maybe an overdose for any of those things, okay? It doesn't matter. It's an overdose. That's the key, okay? Now, any other questions? All right. So here's some other signs to look for, okay? The sternum is the best one I said to look at, but you also have things like gurgling. Maybe they're throwing up or passing out, okay? Now, when they're passing out, that means that you can rub the sternum. Once again, I keep going to that, and there's no response, okay? These are all warning signs that they are headed in the wrong direction. They are going towards an overdose, okay? So what are some of the ways that you have heard people, and maybe you haven't, but I'll use my experts in the field here, people trying to get out of an overdose before? What have you heard? Anybody? Cold shower? Cold shower, yeah. Yep, cold shower. Anything else? Walking them around. Give them some coffee. Those all sound a lot like the same thing we do for alcohol, don't they? Okay, that's exactly what they do. Those are the same exact, arguments. They even have where shooting them with water and stuff like that, and a needle and things like that. I've heard from the Red Project. It's amazing. Oh, the other one, you'll love this one, guys. Putting ice in the area that we would never want ice in. Gentlemen, okay, that's supposed to do that as well. I've heard that one as well. Those are all things that are not going to get them on an overdose, okay? All right, now that we got that clear. I want to show you this picture because when this first started coming about, we have a individual in our community that actually is down the road from you here. A Recovery Pathways. It's on Pine, Dr. Maroney. Dr. Maroney was working on getting these Lazarus kits to the EMS and different individuals. And he got them out to a lot of different people, and that was great. The problem is that at that time, the feds didn't get how bad this issue was. And there wasn't a lot of funding, so when he got done giving out his 100 and some kits, he couldn't give any more kits out because they wouldn't give him any more kits. Now you can go online if you're an organization, go to the portal, click the button, tell them how much you want to use and what you're going to use them for, and they'll deliver them right to you in UPS. Imagine if that was probably 2015, 16, so maybe it's 15, 16 for that video. Imagine if we had done that in 2015, 2016. Maybe it would have made an impact. It certainly would have changed the landscape. It may have still had overdoses, but we wouldn't have the deaths. One of the groups that I'm involved with at Bay County Prevention Network is Project HOPE, Heroin Opiate Prevention Elimination. And our goal, which we're not there yet, is to have 1/4 of no overdose deaths. 1/4 with no overdose deaths, as well as 1/4 with no overdoses. So we have a 6-year plan. Like everybody, we have a plan. And that involves every organization that's here today. They're part of that plan. So it's not just me. So I do a lot of the sometimes speaking and planning and things like that, but I could not do this without Lori Zilakowski, without Jasmine, without Alicia, without Sandy, without Lisa. I could not do this without them. And I can't do it without you either, by the way, because this is a community problem. This is not a individual problem. It is touted that way, by the way. So I wanted to bring that up before I went any further. So, when we end up administering Narcan, which we're going to show you how to do that, don't worry, the one I'm using today is a expired one, so you don't have to worry about me wasting one. I have 40 kits with me, and I know that other organizations have them as well. But we use the 3 A's. Easy to remember. First thing you do is assess the situation. Are they responding? Is it safe for you? If you go to the individual and they're not responding, the first thing you're going to do, take your phone out. You have to do it right now. Call 911. Put it on speaker. If you don't have a speakerphone, put it to you. Call 911. That's the first thing you do. Stay on with 911 this whole time you are doing it. I'll say it again. Stay on the whole time while you're doing whatever I'm going to talk about. And by the way, a lot of times the 911 will walk you through it as well. So don't feel that you're going to be lost. If you have a phone that has a smartphone, there is an app as well, and I can show you that app that actually is from the company that makes this, and they walk you through it with the videos as well. It's a very short process as well. So you need to assess the situation. Is it safe? What's going on? I want to make sure you see that one in between assess in a minute besides 911. Keep calm. I guarantee you're going to have a hard time with that one. But if you don't keep calm, you're going to be flustered. You're not going to be able to listen to the instructions because you are now an individual that will have a spray that can save a life. I'll say that again. You will have a tool of a spray that will save a life. Okay? That's why it's called Project Lazarus, and I think North Carolina is where that came from, remember correctly. So now I'm going to get my Narcan kit. So yours is going to look like this. Believe it or not, it's not going to be open like this, though. Okay? Inside, there's a little thing here about all about the medical, those, how you get those things from the doctor? I don't know about you. I just kind of, yeah, right, whatever. Okay? So the next thing you have is you have two of these. Okay? Okay? Got that? First thing you're going to do after you call 911 and see if they're responding. If they're not responding, you're going to take one of these. Let's see if I can do this right. You're going to take your first 2 fingers and your thumb. You are not going to prime it. And Laura, if you need to help me in this, let me know if I do anything wrong. Because you do more of these than I do. Oh. See, I told you I had experts in the field here. Yeah, 1, 2, 3, it's right there. Okay, so if you get lost, it's right inside there. Okay? I've done this so many times I didn't even think of that. So, yeah, don't rip it open. Oh, no, I got no directions. All right, but you grab the first 2 fingers and your thumb. You're not priming it, but you're going to stick it up the nose all the way up, and I'm not going to squirt it in my nose, by the way. And all you're going to do is push it until it's gone. Okay? Gone. See, there's nothing there. All right, throw that to the side. Where are you still at on what? 911 still, right? Want to make sure you got that because people forget. I can call, hang up. No, you can't. You wait a minute or 2 if they're not responding. Okay? If they're not responding. Got more here. What's even on there for you? See? First 2. That's from the actual Narcan company. You're going to press. You can also put them in a rescue position. Okay? Where you can then make sure their head supported, their knee supported, okay? After putting rescue position, you got the Narcan in, you're waiting a minute or 2. If there's no response, you start. Oh, go back. You start chest compressions. Rephrase that. You start rescue breathing. Correct, Lori? It's been a while since I've done this. I'm sorry. Rescue breathing. Yeah, well, exactly. And that's the thing. That's why I'm giving you some highlights here. But rescue breathing would be the next thing. You pinch the nose just like you would do for CPR and things like that. Now, I will tell you right now, we learned recently that the new CPR actually doesn't use rescue breathing. But the problem is that you still have to get stuff in the airway. So we're still recommending it at this point until we do some more investigation, because people that are teaching that have those bags, they can put on to give them air. Are you going to carry a bag in your pocket? No. You're not even going to carry anything in your purse. So if you have some sort of barrier you can put up there are masks you can get that actually you can put over the face. Yes, ma'am. Right. Nope. I'll get there. Thank you. I love it when people are there in a task. I know you're there. So you've given the Narcan, you've given the rescue breathing, and they're still not responding. Now you take the second pack that you have, you open the blister pack. Once again, this is expired, so I'm going to use it again. Grab it first 2 fingers, shut it up the other nostril, and once again, all the way up. Don't prime it and spray it again. You guys getting any on you? All right. Yeah. So once again, you're waiting to see if that responds. If they don't respond there, still stay with them. Do not leave them at any time until EMS gets there. And I will even stay then, because, you might be able to tell them some information that maybe they didn't get from 911. So, yes, sir. You inhale that, that is safe as water. It's been around since 1965. Yeah. Most people do not come out fighting. Some might, because you just took their high away. Most do not, though. Most end up, it's like, you remember Lazarus? Come out of the tomb? That's exactly what happens. It's basically like they come back to life. It's just amazing what happens. Similar to it, yeah. The ones I'm giving you is till 2023. So this one was done in 2021. So it's in March. I'm like, well, I guess they're still usable, though, in my opinion. But I use the expired one because some people say, well, I don't want an expired one. That way I'm not wasting a kit that actually could be utilized. But I don't believe they're, come on. It's like anything else it's safe as water. It's gotta, you know what I mean? So, please. Yes.
And they sit in the glove box of our car.
Yeah, they ask you to keep them at temperature if you can. They like you to keep them in your purse. Not keeping in your car is probably not a good idea, because the wintertime will probably freeze. Okay? So that's a great question, because a lot of people, I don't think about those things. So that's why we got you here. Exactly. You have to make sure you're storing those properly. I put them in the back of my truck last night. It was only 65 degrees last night, so you're good. Okay? So I made sure that they weren't going to have it. I'm very cautious on that, because I don't want to end up destroying something that's a life-saving device. So that's really important to realize. Let me say that again. These are a life-saving device. Okay? It's still medicine, but it's a life-saving device. Not yet. I know other states do have it over the counter, and you can get it from your pharmacy and things like that, but there is a cost involved in that. Okay? However, you have community organizations, you have Families Against Narcotics, you have the Bay County Prevention Network, we have Ecological, and you have 1016 Recovery Network and Peer 360 Recovery Alliance. They will give you kits for free and come and train you for free. If you know anybody that owns a business, know anybody that has a group of people, they will go anywhere at any time. Trust me, we were in our meeting till 9 o'clock Thursday night. We'll go anywhere at any time. Okay? We want people to have this life-saving device. Because as I said, when you have people that are mixing, you have people that are using alone, you have people that are that have that tolerance level, all those things, it all comes into play when we're taking a look at that situation. Does that make sense? Any other questions about Narcan? Yes, ma'am. I'm sorry. It doesn't matter. It'll still be okay. This is designed to reverse an opiate overdose, but if it's an overdose and you're not sure and you're giving it, it's not going to hurt them. Okay? And the reason that we tell people that we learned the other day about wearing a mask if you can on the face, and I know in life situation, I don't know about you, I'm probably not thinking about that. I just want to save the person's life, is that if they have fentanyl, they may have it in their system and it could go back into you. So just something to be aware of. And I'm not trying to discourage you from doing that, but I'm making you aware of it. Because if you don't know, there have been several law enforcement across the United States that have had the dust even in the air, that have inhaled it, or they've ended up picking up a baggie and grabbing it. I think a lot of our areas now don't really grab them anymore. Michigan State Police are all the ones that handle that because it'll go through the skin. So, nothing. I just have drainage coming down. I don't want that. So, yeah. All right. Great questions, great information. Please. So what you're saying is the half-life of these is short. That's why it's so important to be on with 911. And I hope it doesn't happen, but I know the EMS and different things are starting to see declines in staffing. So I'm hoping that doesn't occur. But that's why it's so important, the 2 vials, because you wait a few minutes, like I said, and you give the rescue breathing in that second. And if they don't wake up, you just need to be there, okay? At least you can tell the loved one that you were there and they didn't die alone. To me, dying alone would be one of the worst things. And I never want to wish that on anybody. I make that very clear. But, yeah, the Good Samaritan law protects you. You don't have to worry about anything. And I think Lori would advocate strongly that get this to anybody and everybody. And I think Lisa would, and I think Alicia would, and I think Jasmine would. If every church and every organization had this, gas stations are a big one as well. So we actually gave out 50, I know Lori had done something before this, we gave about 50 different ones to the hotels in the area. One hotel took 12. They called us 2 weeks later to bring 12 more. Okay? Because they're not saying it's okay, but at least they have the ability to save someone in the event that they're going to end up overdosing, because some of them do use alone. And if they're cleaning the room, or whatever, because it's a lot of times long stay hotels. So just to make you aware of it. We did have one chain, and I'm going to mention the name because I'm sorry, I'm going to shame them. It's the way it is. We went and asked Holiday Inn if they wanted to do that, and they said no. And we heard them in the background say, we don't want to do that. We don't have that problem here. Okay? Sorry, Holiday Inn, I'm being honest. I don't usually shame people, but that is something that we offered a free device to them, and they thought that they didn't need it. Let's take another break. It's 10 after 11. If I were going around and I were asking questions like to individuals, do you think that someday that you some days could develop heart disease? What do you think most people would say? You think wouldn't most people say that someday they could develop heart disease? Most people say, yeah. You can just toss them up here if you want, Lisa, when you're done. How about cancer? If I said, hey, do you think someday that you could develop cancer? What do you think most people would say? Yeah, I think so too. So those are two things that are lifestyle health related diseases, correct? For the most part. But what if I said, do you think someday that you can develop an addiction to alcohol and drugs? What do you think most people would say? No, right? I'm not going to have that problem. That's just for those other people, right? So we're going to talk about language and what that looks like and why this is important. And I had you do that survey. And by the way, that's the same exact survey that we gave to McLaren diversity team and the same exact survey that all 12 communities that she mentioned are doing this Chances Are campaign with. This workshop is part of a whole campaign. That's good, no matter where. Are part of a campaign that has materials available. So if you want more of this information, as far as from a marketing standpoint, we have more stuff, okay? Or we can order more stuff. So understanding that, maybe. You did the survey, see, we're ahead of the game. I did that, I'm just ahead. These are all chronic diseases. Addiction is a chronic disease. Do we treat it as a chronic disease? No, we don't. Do we treat individuals that have substance use as people that have a chronic disease? No. I work at McLaren Bay Region in the diabetes education building. Okay? They are all the time. There's tons of people coming in. Alicia works down the road from me at a recovery drop-in center. Do you think she has people coming in all the time? No. We want to change that, by the way. We want her to be busy. We want to be so busy that she needs another spot. Okay? That's my goal for her. I don't know if that's her goal or not, but that's my goal. So, is this the video?
What is addiction? Also called a substance use disorder. Over 21 million people nationwide suffer from addiction, and 1 in 7 people will experience addiction at some point in their life. Recent increases in the use of opioids have compounded the problem. Each day, we lose 174 people to drug overdoses, and that number climbs to 415 if you factor in alcohol-related deaths. Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then, in 1994, Doctors Volkoff and Shelbert, top neuroscientists, ran PET scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are 2 main parts of the brain affected by drug use, the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here, in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center, and when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. So why don't all people who use alcohol or drugs become addicted? There are factors that contribute to the development of a substance use disorder, including individual factors, like genes and age of exposure, and then environmental factors, like drug availability. But there is good news. Addiction is preventable. The key factors that aid in preventing addiction can be categorized into 2 parts: risk factors, and protective factors. Protective factors range from parental involvement, programs that improve self-control, limiting availability, and increasing attachment to your community. Another key element in preventing substance use disorders is to delay when use begins. Put simply, prevention is about delaying the onset of first use. In the adolescent brain, where brain tissue is more vulnerable, the hijacker is more prone to weaken the brain and plant itself as a disease. Those with substance use disorders commonly initiate first use much earlier, between 12 and 18 years old, which increases the likelihood of the hijacker taking hold. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is. Together, we can solve this. Join us.
I'm just impatient, sorry. So, the reason I showed you that, and I just realized that because I put this in my PowerPoint at 11 o'clock last night, was to remind you that, as Sandy just said, that addiction is a disease. And because we don't treat it as a disease, we have individuals that are stigmatized. So let me ask you this question. How would individuals in our community, or even you, describe a person that has an addiction? What kind of words would they use? And be honest with your words. It's okay. Well, what? A druggie. An addict. Drug user. Sorry? A drunk. What kind of characteristics would people say that have an addiction have? Traits, characteristics, personality types. Unreliable. Loser. Liar. What? Cheat. Thief. Weak. And guess what? Some of those are true at times. They are those things at times. Sometimes they are a thief. But let me ask you this question. Is any individual all those things all the time? Okay? So even though it may seem like that's true, it's just a little true enough where people start to buy it when in reality that's not the actual truth. Does that make sense? And remember, if you repeat something often enough, people start to believe it. Okay? And that's where stigma comes into play. It's so important to understand the importance of language. So, stigma is a social process. It's about power and control. Okay? I'll give an analogy which may not be popular, but that's okay. I don't always like to be popular. Right now, there's, whether you agree or disagree with the vaccine, whatever it is, there are people that are being stigmatized that are doing it, and there are people being stigmatized that are not doing it. So we have both sides of the spectrum. Okay? It is a social process, which can lead to status and discrimination for stigmatization. Now, that's not always true with the vaccine. I understand that. But when we're talking about loss and things like that, loss of job, loss of family, loss of opportunities, we just recently had Judge Gill and Judge Beal at our family forum 2 months, not this last week, but the month before, talk about expungement, because there's a lot of individuals that had felonies 20, 15 years ago that are still paying for the crime they did while they are under the influence. Now they are a very successful individual. They are doing great. In fact, you want to hear something interesting? People in recovery pay their bills better than we do. Okay? Just to make you aware of that. So, they may seem like they're a risk, but they're actually a better risk than some of us. I won't say who that is. I look in the mirror a lot. Okay. You did that? This is what they hear sometimes. How many of you have heard the word junkies said by somebody else? How about crackheads, crack babies? Remember the 90s? Drug addicts, drug users, all those things? I hope lawyer's not going to do this part, but I'm going to steal it anyway because I love Judge, were you going to use Judge's story at all? Okay. So there is a judge that is now the executive director of Famous Against Narcotics that her daughter was dealing with substance use. So she was in the emergency room and mom was there with her and she was wearing sweatpants. Her hair wasn't done, all these things. And this hospital, what you have to understand is this hospital, she was on the board of directors for. They did not know that. She's sitting in the hallway and like, just another junkie with a mom, doesn't know what to do. And that was a turning point for her. But that language is so important. In your packet, in the blue, on the back page, it actually has a list of language that is used and what to use differently. So I'm just going to kind of go over those. How many have heard that somebody says, yeah, I dropped dirty? Anybody heard that one before? What does that mean? Well, that means they actually tested positive for a drug. Okay? Language does matter. Words do matter. And the other one is, you'll notice that I did not say substance abuse. I don't know if you heard that or not. That was on purpose. It's ironic because when you see that door hanger thing I made that you guys have and it's available, I actually wrote that and one of my recovery partners said, you need to fix that. I'm like, yeah, I know, I forgot, sorry. But he let me know. But that's what we need to do. We need to hold each other accountable. In fact, one of our meetings when we're with professionals, and I'll be done in about 2 minutes here, when we're done with professionals, we actually have a system. In our meeting, if we say a stigmatizing word, we go, ouch, to remind ourselves that we're saying it. Because guess what? We do the same exact thing that everybody else does. We are human. And because we're human, we're going to continue to make mistakes. But that's all about those different things. So instead of saying recovering addict, you write a person in recovery. Instead of saying alcoholic, which we say all the time, right? Say a person struggling with alcohol or a person with an alcohol use disorder. Instead of codependency, that's a big one too. We hear that a lot. Okay, emotional resiliency. And I know that in certain circles, those words might be something like, I know in the recovery community, they might use some of those things. But when we're talking from a population standpoint, we want to try to avoid using stigmatized language as much as possible. Because I can tell you right now, the individuals that are stigmatized are less likely to seek services. If they're less likely to seek services, that means that they're more likely to go to the hospital, which means more likely to not to have health insurance. If they don't have health insurance, they're less likely to get the services. You get my drift here, okay? And I'm not going to put it on the spot, but I know we had somebody that actually worked in the ER that actually saw some of these things. And like anything else, funding's an issue. Funding was cut, and unfortunately that position was cut, even though they were starting to see an impact on that area. So I just wanted to make sure you understood that. All right. I'm going to finish up with a video because you do have everything in front of you. And I want to give Lori some time to talk.
Addiction does not discriminate. Addiction is a disease. Addiction is treatable. Chances are you know someone with a substance use disorder. Chances are they need support, not shame. By using non-judgmental, neutral language, we can remove stigma and improve treatment. Chances are your words can change lives.
That video on that website, by the way, is available for download. You can go on there and download it. If you need it, we will provide it to you. You want to link to it to your website, we'll give it to you. Peer 360 Recovery Alliance was chosen to house our thing. They're in 15 different counties throughout the state, I believe it is, something like that. So that's why we utilize them. And just an aside note, really quick, before I let Lori take over, we are currently working on a project, and Lori's like, we got to get this done. I got to get this done. And I'm like, yep, we'll get it done. Just be patient. Change is a process, okay? Anybody that goes in the emergency room that goes there for an overdose, we're looking at giving them or their family member a Narcan kit before they walk out the door. So that is huge, by the way. And we might even have it up in West Branch too. That's something that we're working on too, because their same department is in charge of the other one. So that's sometimes good to have a subsidiary to work together. So I will now turn it over to my esteemed colleague, Lori, to talk about the human side and a little bit about Families Against Narcotics. And can we give her a quick round of applause? And just so you know, I didn't give her a lot of time, because if I give her a lot of time, I know she will. So here you go.
Thank you so much for having me today. It's just such a privilege to be in this room, to be in this sanctuary, and to be with folks who have a big heart and who care. From what I understand, the thought process of having folks today stemmed from a talk that I did at the Food Pantry organization, which is comprised of a lot of different churches. Because one of the things that we find is that a lot of times when people are struggling with substance use, they're also struggling with other things like food insecurity, housing insecurity, domestic violence, and all the other things that come with it. And so thank you so much to the church bodies who have supported us, provided us bags of food that we are now giving out to folks who have a wait time before they get a bed into treatment, or for those who are transitioning from treatment centers into recovery housing and are waiting on either getting a job or getting a bridge card. We're feeding people, and that's your mission, and I'm so thankful for your heart in that. Can you put my family picture up there, Andrew? Andrew's working on it. So I'm a proud mom, and I carry around large pictures of my family, as we all do. Raise your hand if you're a parent. Any grandparents in here? Awesome. Well, I'll be in a good group then. I'm just going to share a little bit about my family, and in this environment, a little bit about my faith, which is a real privilege, and a little bit about Families Against Narcotics. I am a Bay City girl. My last name is Zilkowski, and if you're not Polish, you have to marry someone or they kick you out. So I married him 31 years ago. Barry gave his heritage. I'm a Zender and a McGivern, so I'm German and Irish, and if you don't think addiction doesn't run in my bloodline, you're wrong. Because my grandparents actually started Zender's restaurant. My great-grandparents did, and they received the largest fine during Prohibition because they were running a blind pig. And so Germans like their beer, and that doesn't bode well for your offspring because they're more likely to get addicted. So that's my beautiful family. My husband Kevin and I just celebrated 31 years of wedded bliss most of the time. Thank you. Yes, that deserves a round of applause. That applause was for him. And that's our daughter, Amanda. We are lifelong Bay County residents, spent most of our time in Bangor Township. We just moved to Auburn a year ago. I'm a college professor at Delta. I teach business classes. I've had a 30-year career in business. 10 years of it was as a pharmaceutical sales rep, and I launched one of those narcotics that now is responsible for killing people. And at the time we launched Ultram, which is tramadol, I had a garage full of it because it wasn't even scheduled. And we were told to tell doctors it's safe when used for pain. Nobody can get addicted to it. Just give it out, give it out. And unknowingly, I was a part of that problem. I think that God has a really powerful way of taking an experience and using it later in your life. My most important accomplishment is I'm a mom, and I'm a mom to that girl, Amanda. She's our only daughter. And in 2013, the year after she finished her first year at Delta College, she experienced a non-fatal heroin overdose. And unbeknownst to us, she was a heroin addict. And so as I watched that very powerful film that Barry shared, looking for the signs that I could have missed, none of those signs were what we saw. She was really good at hiding it. I think that video shows later stages of use where they can't hide it anymore, and eventually we found needles, and eventually we found receipts for needles, and eventually I found little white cotton puffs in her room. but she hit it. She was a smart kid. She was an honor student. She was ranked second in volleyball. She played volleyball since 5th grade. She got a new boyfriend in the summer of her junior year who was 4 years older than she was. Let me hear a big, oh. Because as a parent, you're like, oh man, here we go, right? And he wasn't a bad kid. He's from a prominent family in Bay County too, but every time he came over, he smelled like marijuana. And so we were not a fan. So you have a decision to make as a parent, forbid her from seeing him. Well, that's not going to work, right? So we had him over as often as possible. We kept an eye on that little weasel. And soon the relationship was over, as it would be, right? Summer romances when you're in high school. Most of them don't last long in the 40-year marriages. I do have a friend that did. But she got to know his friends, and she changed her friend group. She started hanging around those older people. And when you're 16 and have a car and you've been a responsible student and a responsible sports player, we trusted her. She never gave us a reason not to trust her. But she started hanging around other people who had availability of substances that she didn't. She would drink after some football games. She never liked alcohol. And even though that's illegal, I would say that in our culture, that is very common. Marijuana now, I'm from Bangor Township. Stand on the corner of Tim Hortons and you can count 12 shops, okay? I don't care if you're a grown adult and you want to stay home and smoke your weed or eat your edibles, fine. But what we don't do a good job of in our culture is stopping kids from getting that, because most people get their first drink from their garage refrigerator, or if you're fancy, from the liquor cabinet. I stole cigarettes from my mom when I smoked when I was a teenager. And I'm a Lutheran girl. My grandpa was a Lutheran pastor at Zion Lutheran over on Kiesel Street. I know, sorry, Grandpa. And so this isn't, addiction is not about not being raised well. Most of the families I know are great parents. Most of the families who've have people in their lives, they're great parents. This is not a bad parenting epidemic. And it's not a dumb teenage decision epidemic. Raise your hand if you ever made a dumb teenage decision. Yeah, okay. So my daughter started when she was 15, 16, low-level stuff like alcohol and marijuana. And then it progressed to taking an Adderall on Sunday so she could study. As a college professor, I know that Adderall is the #1 abused prescription medication on the college campus. Kids think it's safe. Everybody takes it. And instead of drinking coffee to stay up all night and read your paper or write your papers like I did, they take Adderall. And it's highly addictive for people who don't have ADHD. And then you're not feeling so great on Monday, so what do? Take a Vicodin. Okay, 1 Vicodin led into 7. Wasn't enough, and she learned how to shoot up heroin by watching a YouTube video. What we saw was a decline in self-care, weight loss, sleep schedule got flipped around. She became irritable and not pleasant to be around, because people who are in withdrawal are not pleasant to be around, and she changed her friend group. That's what we saw. That's how young people get addicted. Other people, that's kind of like the zero entry pool, right? You start with low-level stuff and all of a sudden you're up to here and you don't know how you got there. The other way that older adults get addicted is you go in for a legitimate surgery or an injury and your doctor prescribes a prescription narcotic and you become addicted. People don't get addicted to drugs. Drugs addict people. It's how they work in the brain. So it's not a moral failing. It's just how your brain works. And so I'm ashamed to say that before we had this experience in our family, I was one of those judgmental people. And I was like, oh, just get it together. Even with my own daughter, you're ruining our life. You're ruining your life. Just knock it off. What are you doing? Knock it off. And I did that for 2.5 years. 2.5 years. And I thought I was a bad parent and she was a bad kid and she just couldn't get it together. And finally, as an educator, I thought, clearly there's some stuff that I don't know, and I set off to learn. And I'm still learning every day. I learned from Barry. I learned from Lisa. I learned from Sandy. I learned from the community on all the things I don't know. Because I am not an expert in this. I'm an MOM. Okay? But Barry can educate your brain. I hope to change your heart. That these are the folks. This is what a drug addict looks like. And I use that term stigmatizing for a purpose, because I used to think of it that way. I don't think of it that way anymore. And if somebody would call my daughter a junkie or a drug addict or call me a bad mom because my daughter has this disease, that is so hurtful, so unnecessarily hurtful. I come from a family who struggles with alcohol. And, we always called them, oh, they're just an alcoholic. I don't do that anymore because it's very hurtful. And so we try not to use those words. And it's a language change for sure, and I'm still learning. So I'm going to have you go ahead, Andrew, and switch it over to the website. So I felt helpless for a really long time when my daughter was struggling. I felt like I couldn't do anything, and finally I decided I would speak out on campus. Because here we have our Hope Not Handcuffs program. We started this 3 years ago, and this allows a person struggling with substance use disorder to walk into a police department and ask for help. Isn't that the most preposterous thing you ever heard? It took a little convincing on our part to let the police know that this is the right thing to do, but it's working. And so the way that happens is you can walk into a police department or call our Hope line, and we dispatch an angel. And an angel is a community member who has a heart for people, who is willing to spend half an hour, 2 hours helping a person get a bed into treatment. If you're having a heart attack, where do you go? To the emergency room, to the hospital. If you're struggling with opioid withdrawals, where do you go? Hospital's going to turn you away. They're going to say, sorry, that's not what we do here. It's not what they do there. And so finding treatment is challenging because of insurance, because of transportation. We provide free transportation. So church bodies are full of angels. I see halos glowing all through the sanctuary. We can put you through a 2-hour training, and you can help get those people into treatment. And how that works is you come to our training. If somebody walks into the Bay County Police Department, we get a lot of folks who come from Good Samaritan Rescue Mission over there, because oftentimes addiction takes everything from you, including your housing. They walk into the police department, the police call us, either me or Jason, my colleague, and they say, we have a person who needs help. We put it out on a GroupMe, which is just a little app on your phone. And we put it out there, hey, angels, we have a walk-in in the police department who can go assist. You drive over to the police department, you put the skills in place that we taught you. We are on the phone with you as you do the assessment and help you find a bed into treatment for that person. Or if we get an online application or somebody calls, you can do it right from your own home. You can assist just by calling a person, doing an intake online, and then helping them find a bed into treatment, and we help you with that all along the way. So if you are interested in that, or if you are, take these back to your church, they're on our table. We're doing virtual angel trainings right now, but if you can get a group of people together, we will come and do an in-person angel training. Okay? It's a wonderful experience, and it's a great way to give back. So the Hope Not Handcuffs program has helped. I'm trying to remember the numbers. I should have brought the sheet from Thursday night. Almost 500 people in the last 3 years between Bay, Saginaw, and Midland. Yeah, assisted almost 500 people. And think of the ripple effect to the families, to their employers, to the community, what that means. Because if people aren't struggling with substance use, guess what? They're not stealing. They're not less likely to commit domestic violence. They're not homeless on the streets. They're productive. And we not only, so the Narcan, and I wanted to show you my little fancy pouch because I'm all about being fancy. I got this from Yonkers before Yonkers closed. Don't you miss Yonkers? Oh, and Christopher and Banks, what are we going to wear from now on? I don't know, man. There's nowhere to buy clothing. Well, I'll be wearing masks and no clothes pretty soon, I fear. So the box that Barry shared is big and cumbersome, and I don't know about you, but for women, it's a little easier to carry this around. So I took mine out of the package, and I have them in my little pouch, and I carry this in my handbag. You could put it in a Ziploc bag, but this is just easier than just carrying that giant box around. So feel free to unpack them and just have them in a Ziploc bag. All right, I got 1 minute left, maybe. Oh, I'm over time. Okay, just very quickly, stop by the table. You can see the other programs that we have. We have peer and family recovery coaches. These are folks with lived experience like me and like folks in recovery who can connect with folks who are struggling. It's something I wish we would have had when we were navigating this. And everything we do is free. You can connect with us, and we can provide somebody with lived experience to help you navigate either your loved one or yourself. We have virtual Stronger Together meetings, which is the support group aspect of what we do, and we are working on getting one in Bay County. I will tell you that in the last 6 weeks, I've had 5 Essexville mothers reach out to me with sons between the ages of 17 and 25 who are in a crisis as we speak right now. Essexville, I've been a lifelong member here. Essexville is a wealthier upscale community. right? So is Midland, so is Frankenmuth. We cannot be misguided that this doesn't happen here. It is happening here, and families are being devastated. But we can do some things about it. So please help us. If we could do an angel training, we would be happy to do that. Support us in the community. Come see us at a fan forum. I've never felt so much love in a room as when we're at that fan forum. I appreciate your time today and listening. God bless all of you.
Thank you, Lori. And just as an FYI, you do have a packet, the role of faith-based organizations. But I'm going to give you some quick things you can do, and I'd love to have a meeting with your leadership. I actually have an individual that I have designated to go to all the churches in the area to set up a faith-based initiative, because I believe the faith-based organizations are an untapped wealth of potential. That's the best way to say it, I think. So number one, sign up as an angel. You could do that. Number two, if you have food and stuff like that you'd like to donate, Lori does put some things together for different individuals going to the Hope Nine Handcuffs program. You can also be an individual that is a connector. Connector basically means that you connect us with people that need us in some way, whether it's an organization where we can do a presentation and educate people, whether it is an opportunity to referral. We have 3 or 4 different organizations here today that can help people. You know, did you know about List Ecological and all the things they did? Did you look at their table? Hopefully you did. Did you look at all the things that Alicia has to offer, Recovery Drop-In Center and all those different things? Did you look at all the things NADA, which is a grassroots organization, by the way? So thank you for being there and doing something like this in the Auburn community as well. So don't forget, there are things you can do. And the one thing that everybody forgets is prayer. I challenge everyone in this room tonight to just say a prayer that individuals that are struggling, those that are in recovery, and those that have lost someone know that there is somebody out there that can help them, and that he is sitting right by them, guiding them, holding their hand the whole time when they're going through it. I think we forget about that. I think it's important to do that. Remember my first verse in the beginning, trust in the Lord with all your heart, not lean on your understandings, and all your ways acknowledge him, and he will direct your paths. That's exactly what hopefully you're going to do now today. You're going to remember that when you're looking at prayer and looking at that from that aspect of it. It's another thing you can do would be to let people in the community know about this. Everybody told one person today. That's 35 more people we reach, which might be 35 more and 35 more. It's amazing how many individuals you can reach. I talked at one event, and since that one event in 2005 is when I took, 2010 is when I took over, somewhere around there. We have over 65 organizations that we work with in some way, shape, or form through a connecting process, whether it's a referral, whatever it may be. And that's why our partners are here today, because we value partners, and we love for you to be a valued partner. Does anybody have any questions for anybody that is here today, as far as whether it's 1016 Recovery Network, Jasmine, Nada? Is there anything else you'd like to know about them? Is any of the organization want to say anything? If you want to, you can. If not, that's okay too. I'll give you the option because I just want to make you feel welcomed. With that said, I have 2 quick thank yous. Number one, I want to thank Jesus for allowing me to be here. Secondly, for you. And thirdly, I think she doesn't get enough credit, my wife, for allowing me to take the time out of my day to be here today. So I'll turn over to the closing. Yep, you got a question? Okay. 2 questions. All right, 2 questions. Here we go. What is it? TriStar. It's TriCap. If you want to know about TriCap, I know there's some individuals in the room that can help you. It's if I remember correctly, it is a place that individuals struggling with substance use can utilize as a tool. That's the best way to say it. Yep. Well, according to the federal law, it's within 1,000 feet of a school is a drug-free school zone. Okay, they're not supposed to have any drug. Now, see, there's a problem with that. You have to understand, which people don't get. The 1,000 feet is wherever they determine the entrance is to the building, not to all the side entrances. As an example, my church has a school, and they just put a marijuana dispensary on, what is it? Cass Avenue and Broadway. Right, it used to be right across from McDonald's there at one point. That is just over 1,000 from their entrance to either their daycare, which is down the road from them, right across from the old, right across from Coca-Cola building there. Yeah, it's just above 1,000 feet. So yeah, and it might be the center of the road. I mean, there's all sorts of different things. Yeah, so that's all I can tell you for that one. Yes. Opioid. They're the same. They're just interchangeable words. Yep. All right. I will now turn over to our closing, to Bev.
Okay. Well, the United Methodist Women of this. Can you hear me now? The United Methodist Women were so fortunate in this church to be able to support this, and we are so glad that you all came. But before we leave and go to our homes, I would like to remind you of a book in the Bible in Matthew, of a verse in chapter 26, verse 41. It says, keep alert and pray. Otherwise, temptation will overpower you, for though the spirit is willing enough, the body is weak. Let us pray. Father, you remind us to pray and be mindful of not being led into temptation. The difficult part is that temptation seems to jump in our path all the time. If we're trying to lose weight, all we think about is food, and every commercial makes us feel hungry. Help us. Help those who struggle with addiction to things that are shortening their lives, costing them friendships, and causing them hardships. Thank you for the leaders here today for the work that they do. And if we feel so moved, I hope that some of us can find it in our hearts to help them. Lead us not into temptation, but deliver us from evil. Amen. And you will be hearing from us again, because we are going to give a gift to each one of the presenters and to you, Barry. But we have to go through certain measures to be sure it's okay. Thank you. And I hope you all learned something today. I certainly did.